Hi, my name is Heather Francisco and I'm a Board Certified Behavior Analyst with DiNovi & Associates. This video will address school refusal, which satisfies the following skills from the BACB task list. F6, describe the common functions of problem behavior, and G1, use positive and negative reinforcement procedures to strengthen behavior. One tool that has been helpful in assessing school refusal is the School Refusal Assessment Scale Revised, known as SRAS-R.
Leading researcher in school refusal, Christopher A. Kearney, first developed this tool in 1993 and revised it in 2001.
The SRAS-R is designed to measure the function of school refusal in children ages 5 and up. The results of this assessment provide professionals with data about a child's school refusal behaviors, which allows them to program more effectively.
According to Kearney in his 2001 article, the SRAS-R examines 4 functions of school refusal.
These are 1. Avoiding school because of stimuli that evoke negative emotions and responses. 2. Avoiding aversive social situations at school. 3. Desiring attention from caregivers. And 4. Pursuing positive reinforcement outside of school. The first function involves the type of school refusal in which children may complain of physical aches and pains because of something at school. This commonly refers to younger children who have an upset stomach prior to getting on the bus, or who feel dizzy just walking into the school. Similarly, the second function also involves the type of school refusal that avoids situations that produce anxious or negative feelings. This function occurs more often in older children who may want to avoid social interactions with peers or giving presentations in class. The third function describes school-refusing children who seek connection and time with their primary caregivers. They might not be averse to going to school, but instead they are more averse to being separated from their caregiver. The fourth function describes school-refusing children who aren't necessarily averse to school-based stimuli, but rather seek positive reinforcement from activities or people outside of school. In this case, children refuse school in favor of watching television, sleeping, or spending time with friends. So how is the school refusal assessment scale interpreted? The SRAS-R provides empirical data that is valuable when developing a student's school refusal treatment plan. The SRAS-R is a 24-question survey with 6 questions dedicated to each of the 4 functions. Both children and parents take the assessment. For each question, children indicate how often they feel or behave a certain way, based on a Likert scale from 0, which is never, to 6, which is always. On their own survey, parents respond how often they witness their child behaving a certain way using the same scale. School personnel can also complete the survey for comparative data. To interpret the SRAS, professionals will first score parents and children separately. On each assessment, the average score for each of the 4 functions will be calculated. Then the average scores from each assessment will be combined and divided by 2. The function that ranks highest is considered the primary function, but 2 functions that score within 0.5 of each other are considered equal. Kearney et al. Still consider low-ranking functions when they design a treatment plan. While the assessment provides useful data, it shouldn't be the only information that professionals use in designing an effective and function-based treatment package. Kearney also suggests confirming SRAS-R results with behavioral observations, descriptive analyses, or experimental analyses to ensure that the most effective school refusal treatment plan can be developed. For example, an SRAS-R might indicate that a child's primary function of school refusal is to avoid school because of aversive social situations. After interviewing the child and teachers, it would appear useful to conduct an experiment to compare how the child behaves on days when there is a test or class presentation with how the child behaves on days when there is no test or class presentation. The experiment helps verify more certainly the child's primary function of school refusal. As a result, a professional can determine a more effective course of treatment. Behavioral observations are especially critical in cases where substantial disagreement occurs among descriptive measures. Again, these procedures have been outlined previously, but involve situations where a child is asked to attend school under certain conditions to confirm or disconfirm a given functional hypothesis. For example, a child may claim that he misses school to avoid stimuli that provoke negative emotions, though his parents claim he misses school for tangible reinforcement outside of the school environment. In this situation, a child may be asked to attend school under conditions that would seem highly favorable to him given his report, e.g. on a Saturday where there is few people around. If the child is able to attend school under these conditions, then support is obtained for the functional profile. In addition, the child may be asked to attend school with substantial incentives as per parental expectations. If the child is unable to attend school even with these incentives, then the parent report is disconfirmed. Behavior analytic approaches for school refusers are primarily exposure-based and draw upon such techniques as toleration training, escape extinction, modeling, shaping, and contingency management. Kearney et al. Also outline general strategies for parents to treat school refusal. These strategies include, number 1, maintaining a neutral and calm tone and manner. Parents can acknowledge a child's fears by providing a verbal statement of understanding while assuring the child that they are there to help. 2, ask questions. Parents should find out why a child is refusing to go to school. Parents can ask their child, are you nervous or anxious about just one thing or several things? Are there any harmful or dangerous situations at school? Analyzing why a child doesn't want to go to school from the child's perspective may help to devise a solution. 3, talk to administration at the school. There are many reasons that a child may be afraid when it comes to attending school. If a parent discovers the problem is one that can be helped, speak to the school administration and the child's teacher. Having an individualized education program created may be beneficial, as this will help explore evidence-based behavior interventions for the school refusal. 4, encourage your child. As a parent, it is crucial that a child is encouraged to go to school every single day, even if they only go for a very short time. If a parent allows a child to continue staying home, it may reinforce their thinking that the school is actually aversive. In some cases, the child may be allowed to sit in the library, lunchroom, or another area with a parent or trusted adult. The goal is to get the child to go and stay at school by using best behavior practices. Once the child starts going, the behavior momentum is established. Number 5, take small steps. A parent can reinforce small approximations and steps with the child, helping them move past what's making them uncomfortable. This procedure is called shaping. Parents can set criteria for how long a child will remain on a step before progressing to the next step. 6, hire a tutor. If you have a child who is at risk of falling behind in school, then it might be helpful to hire an academic tutor. If they fall behind academically, it could increase their anxiety, making it more difficult for them to return to school in the future. Even if a parent is qualified to provide academic instruction, working with someone else can be extremely crucial in getting them back inside their normal school and classroom routine. Number 7, partial successes count. It is a good idea to emphasize and reinforce partial successes. A parent can create a reinforcement system in which the child can earn a pre-established reward or reinforcer for meeting short-time goals and expectations. Parent can use differential reinforcement. This will provide more reinforcement for advancing steps. If the child is unable to progress to the next step, then parents can praise their attempt and encourage them to try once more for the next day. Number 8, expect and work with setbacks. There are going to be setbacks. While a parent should expect them, it's still important that a parent is consistent with the plans set. If a child is unable to keep up with the criteria, or if they are unable to make new progress, parents can offer acceptance and support. However, a parent should never stop providing clear expectations, which is for the child to return to school. Number 9, replace the child's faulty defense mechanisms. Every child is going to have certain crutches, such as eating in the classroom or coming home early. Replace these with coping tools that will be more effective. Parents can help their children not only understand the source of their anxiety, but also accept it and move forward toward what the child may value. A parent can also teach a child how to identify values and diffuse negative thought patterns and move forward using acceptance and commitment therapy. This will help the child to overcome the issues related to cases of school refusal. Please stay tuned for more on this. Thank you for watching. Please subscribe and post any comments below.